one of the things that that we can measure in terms of the functioning of the heart is its cardiac output. So this is the amount of blood that is pumped by each ventricle in a minute. So defined as the amount of blood. Oh, why is this not? Doesn't like that spot. Amount of blood pumped by each ventricle in a minute. So at rest, it is usually about 5.25 liters per minute. Now, we can talk about how we could increase our cardiac output if we're exercising. So if we're exercising, this could go up to like 20 or 25 liters per minute. And so you could increase your cardiac output. If you're an athlete, you might even be able to increase your cardiac output even more. But it's generally when you're exercising, a normal person, you say that the cardiac output can be increased 4 to 5 times at rest compared to your rest. So that would be about 25 liters per minute if it's 5 times, right? 4 times would be 20 about. Okay, so that's while you're exercising. Okay, so what determines the cardiac output? We can use a mathematical formula. So we could say the cardiac output equals your heart rate, which is beats per minute, times what we're going to call stroke volume. So obviously, as your heart rate increases, because that's the amount of beats per minute, your cardiac output is also going to increase. So part of this exercising and getting it up to that would be due to an increase in your heart rate. The other part has to do with what is referred to as the stroke volume. So this would be the amount of blood that is pumped out of each ventricle. So when we look at, like, for example, stroke volume at rest is about 70 mils per minute. Oops, not per minute, per beat. 70 mils per beat. There we go. So every time your ventricles contract, they push out about 70 mils of blood. Now, what could influence how much blood is being pushed out of the heart? So let's look at stroke volume. Influenced by 3 factors. The first of these factors is the amount of blood that is coming back to your heart. Like if you had low blood volume, for example, if you were like, for example, were low in blood, dehydrated maybe, for example, then there would be less stroke volume. So that is what we call the preload. So that's the amount of blood coming back to your heart. That is going to affect the amount of blood being pumped out. Next, we have the contractility of the heart itself. So how forcefully the heart is pumping. The reason for this is that your blood vessels are filled with blood. And so if the heart is pumping at a greater, if it's contracting more greatly, right? If your heart is contracting well, then it's going to be able to force blood out and into your circulatory vessels. So that is a factor of stroke volume. And then we have what is called afterload. And afterload has to do with the blood pressure being exerted back on the heart. So the blood pressure exerted back on heart, right? So if you have high blood pressure and maybe your arteries are constricted, then you're going to have to contract your heart more forcefully to get the blood to move out, because it's moving against this system that is filled with blood. So you have to force it to go out. And so those are actually three of the things, right, that influence that stroke volume. So if you increase preload and you increase contractility, then you're going to increase your cardiac output. If you increase afterload, however, that is going to decrease, right? So this is the one that decreases. So if you increase afterload, then you're going to decrease cardiac output. The other ones increase it. So high blood pressure, for example, you're going to have to, your heart's going to have to work harder, right? So that's one of the problems is that with an overworked heart, sometimes the heart can become damaged, and then you get heart failure, like congestive heart failure. And so that becomes a problem, and that influences how healthy you are. So there is a diagram that shows all the things that are affecting your cardiac output. So again, we talked about how the sympathetic and the parasympathetic influence heart rate. This is my stroke volume. This is my venous return, right? How much blood is coming in. This is my contractility. And then there would also be like a force that you would have to come over to get the blood out, which would also be the afterload, which has to do with the ending systolic volume. So these are ending diastolic volume and ending systolic volume, which also influence your cardiac output.